vision. 80% of avoidable blindness is caused by uncorrected refractive error. But what is refractive error? Refractive error is a visual condition wherein the eye cannot focus the image on the retina, causing blurring of vision. Refractive errors have different types depending on where and how the image is focused on the eye. A normal, healthy eye would focus a single image on the retina, giving 20/20 vision. In a hyperopic or farsighted eye, the image is focused behind the retina, causing blurring of vision here. While in myopia or nearsightedness, the image would focus in front of the retina, causing blurring of vision far. For an eye with astigmatism, instead of one focus, two foci in different distances from the retina is produced, causing blurring of vision at both near and far. If left uncorrected, refractive errors may cause visual impairment in the lives of millions of people. In the Philippines, there are only a few studies that determine the prevalence of refractive errors. These prevalence studies would help raise awareness of the importance of creating a visual health program that would be suitable for the country's needs and concerns. This is in accordance with the WHO's goals for Vision 2020. The inadequacy of visual health services for children in the Philippines is evident in schools, where there usually are medical and dental clinics but no eye care clinics, and no regular vision screening done. This study can help raise awareness in both government and private sectors on the importance of visual health care in children. It also aims to incorporate the strategies of the Global Initiative for Elimination of Avoidable Blindness by the WHO. In line with this, the researchers conducted a study entitled Prevalence of Refractive Errors Among High School Students of Quezon City Public Schools, Basis for a School-Based Vision and Eye Care Program.
In collaboration with Christian Advocacy Reaching Everyone Foundation, Cataract and Ocular Foundation, the researchers conducted the following data gathering procedures. Along with the clinicians and 6-year interns of Central Escolar University College of Optometry, the CEU researchers trained public high school teachers to do vision screening wherein they were taught how to take visual acuity and modified ocular motility testing. After the training of the teachers, they were given a week to screen their students. They filled out these vision screening forms and made sure the questions were answered properly. Those students who failed the vision screening were given parent consent forms addressing the parents that their child will undergo a comprehensive eye examination and cycloplegic drugs may be instilled in their eye. The students must first register before they could proceed with the examination. During the registration, they must return the vision screening forms filled out by their teachers as well as the parent consent forms, allowing them to be a part of this examination. There were about 770 students who were registered and were examined. After the registration, they are brought to the objective refraction area for the measurement of the amount of refractive error with the use of automated refractometer. During the preliminary examination, a brief case history was taken as well as cover tests to rule out strabismus. Visual acuity was also rechecked during the preliminary examination. After the preliminary examination, the students were brought to the external examination area wherein the anterior chamber depth was examined. This is important for cycloplegia. This also checks for any external ocular pathology that was excluded in the study. Direct ophthalmoscopy was done to determine if the student has any internal ocular pathology in which one of the students examined had and was excluded in the study. Subjective refraction was done to subjectively measure for the refractive error present. Those with a difference of 75 diopters in automated refraction trials, as well as those visual acuities and subjective refraction findings that do not coincide were brought to the consultation area for the cycloplegic installation. Patients with a power of minus 50 diopter and above, plus 1 diopter and above, and a cylinder power of minus 75 and above were included in the study. Those with plus 75 to minus 25 diopters were considered as emmetropes, and there were about 88 emmetropes who were excluded in the study. Out of 770 examined, 89 were excluded and 681 were considered as subjects. The researchers asked the following questions in the statement of the problem. What is the profile of the subjects according to age and gender? Table 1 shows that the subjects of this study are from ages 12 to 18 years old and above, and majority of the subjects are 14 years old, followed by 15 years old. Table 2 shows that majority of the subjects were females, comprising 67% of the population. The second statement of the problem is, what is the prevalent refractive error present among the subjects? Table 3 and 4 shows that low myopia is the most prevalent refractive error, followed by moderate with the role astigmatism, and hyperopia being the least prevalent. The prevalence of low myopia is similar to the studies conducted in Hong Kong, Singapore, southern China, Nepal, Iran, and even in Western countries such as Germany. In these studies, hyperopia was also the least prevalent refractive error. A study published in the Philippine Journal of Ophthalmology states that myopia was the most predominant refractive error in the study, which is similar to the East Asian population-based reports. In this study, withdrawal astigmatism is the most prevalent type of astigmatism, which was similar to the findings in China and Pakistan. Withdrawal astigmatism tends to be more predominant in younger age group. This is due to the blinking mechanism wherein the stiff upper tarsal plate exerts pressure on the cornea. This is according to Graupner in his book Primary Care Optometry. The third statement of the problem is, what is the prevalence of refractive error when grouped according to profile? When grouped according to age, low myopia is still the most prevalent refractive error. In tables 5 and 6, it shows that there is a trend of increase in the incidence of myopia in ages 12 to 15, although the p-value shows that there is no significant relationship between age and refractive error. This is contrary to the study conducted in Hong Kong and Iran, although there is a significant correlation between age and refractive error. The reason why there is no relationship between age and refractive error in this study is because of the small age range. When grouped according to gender, low myopia is prevalent in both male and female. It shows that there is no significant relationship between gender and refractive error. Although this is contrary to the study in Germany and Iran, but similar to the study published in the Philippine Journal of Ophthalmology. The fourth statement of the problem is, what is the proposed school-based vision and eye care program?
According to the American Optometry Association, an estimate of 80% of learning is done through vision. In line with this, the researchers created a vision and eye care program that aims to raise awareness about eye health issues in the Philippines and educate students about proper vision and eye care as well as promote vision care. The vision eye care program contains the following: an educational portfolio for teachers, which was prepared to promote students' awareness on common eye problems, which includes refractive errors, common eye problems related to the use of digital devices, and proper visual hygiene, as well as the classroom ergonomics. This includes the definition of ergonomics, ISO standard level of illumination that is appropriate for continuous work, and the current condition of high schools in Quezon City. Annual vision and eye health assessment. This includes the epidemiology report from WHO and the strategies of the Global Initiative for the Elimination of Avoidable Blindness, which are also in line with the study, and recommended tests for the vision eye health screening. For this study, the following conclusions were drawn. There is no significant relationship between the profile and refractive errors present among the subjects. Low myopia is the most prevalent refractive error in the subjects. Hyperopia is the least prevalent refractive error, and the most prevalent type of astigmatism is with the low. The researchers came up with the following recommendations. For eye care practitioners, optometry should immerse themselves in community vision and eye health screening program for the advancement of optometry practice in the community. Ophthalmologists should also be involved in comprehensive assessment of ocular health and as well as improve the partnership between optometrists for the further care of Filipino eye care. For the national government, the Department of Health and the Department of Education should improve and conduct more vision screenings with the help of licensed eye care practitioners in schools. For future researchers, they should broaden their subjects and conduct longitudinal studies for a more in-depth study. For educators, they should undergo training for vision screening and enable themselves to encourage the students as well as parents to care for their eyes. With only less than 5 years before the target year 2020, the researchers are aiming for the realization of the Vision 2020 Global Initiative by contributing in the legislation of an act for a national eye care program by providing valuable information of the prevalence of refractive errors in public high schools in one of the most populated cities in the Philippines. Thank you. We are now open for your questions.
been forgetting to comment on from the very first presentation. Actually, pareho pala kami dahil we were getting distracted with the background music. Tapos kayo wala kayong background music. So, bigla namin na so, we are able to focus more. And then, ay aking objective. Siguro kung di ba iwasan na babanggitin yung ophthalmology, you might as well change the term to partner with ophthalmologists and be part of the team with ophthalmologists, no? Para hindi natin pag-alaman yung term nila. Ayun. So, we do not make recommendations for another profession. So, yan muna so far.
Okay. Congratulations to Rafanan. You did a very nice job, especially for the programs actually with matching things that you will be able to implement easily and right away. That's very good. So there are two things lang. First of all is I just saw in your page 15 now when you actually define myopia and hyperopia. It's actually not very optometry. So I'm not sure whether it was done intentionally or
We intended it to be in layman's terms because we wanted everyone to be able to understand our study so they could actually understand why we need to do this study and why we have to know the information.
yes, but I guess this is research, and at the same time you're facing, if ever you win, you will be, and it will be published in an optometric conference. It has to be in an optical, in our optometry terms, I guess. Right? And another thing is, again, my question still lies that, do you think there will be a significant difference if you say the right eye of both male and female group of which will have a low myopia as compared to, okay, I have 1,500 eyes, percentage, a percentage of just rather than doing a right eye, left eye. Do you think there's a significance?
Because when we were looking at the tables for left eye and right eye, we noticed that there were some of the refractive errors were not equal in right eye and left eye. There were some percentages that were not equal. So we thought that if we combined it, the prevalence would also change. So we also consulted with our statistician. She said that it would be better if we indicated the right eye and the both eyes instead of both eyes and prevalence, because she also noticed the changes in percentages, which is we all believe would actually make a significant in the statistics.
Although kasi when you talk about low myopia, I think you have a range of -50 to -3. Right, so normally, if you look into a paper, it doesn't really make a big difference on our part. Okay? And lastly, I think what is actually missing, or maybe looking at, is maybe some charts. It's easier to understand. I know that you have some Excel sheets, but I think having charts would actually make it really easy. Thank you.
Okay, I will focus the question on the eye care program that you have proposed. Okay, is this for both public and private high school facilities?
The program we made was for the use of both public and private because it is cost effective and it is easily implemented. So even the private schools or the public school can both apply it. So, but we intended the program for public schools because the materials we were going to use was very cost effective.
So you will provide the materials for the schools, or you will recommend the materials that will be used for the school in the program?
We will recommend it to that at the DOH because they will be the ones who have the authority to actually implement the vision and micro program.
Okay. So one of the objectives of your program is to establish comprehensive eye care services in the school. Who will manage this one?
We are recommending for the schools to have optometrists, licensed optometrists to actually perform the vision screening, or it would be done once a year, so they could contact one optometrist or a couple of optometrists and set a schedule for them to actually perform the vision screening at a certain time. So it would be easier because we have limited numbers of optometrists. The number of optometrists cannot cover the population of the Philippines and the students.
Yeah, that's why I'm asking who will manage the eye care services, because if you will propose that all public schools or high schools in the Philippines will be okay with an eye care center, probably we will be having problems in terms of the number who will cater to the needs of the schools. That's why I would like to ask if this is for the government, for the school, or for the district where the school belongs.
The program we made was actually for the national government, so they would improve it, because those are just our suggestions based on our study, what we observed from doing the examination. So the information we have in the program is sample for them, so they can use it as a guide on what they should do, because that is what we observe while conducting the study.
Okay. Second objective is to train human resources.
Sir, that is the global initiative strategy.
This
sir.
one, this is not yours.
No, sir, that was in the introduction part of the. We are actually in line with the global strategies. Our objectives was the first part.
This one, the introduction, is your objective, and
And
the
then the
second
other
part.
one was, it says in line with the global initiative.
I see. Okay, I missed this part. But I thought this is the objective of the program that you propose. That's why I'm asking if this is for both public and private school. But for private school, probably they do this. Okay, but for public schools, they don't have difficulty in following the recommendations. Okay. And then the rest of the content of the program, the package, sa inyo.
Yeah.
Like for example, how will you evaluate if what or who you have trained were able to get the level of competency in assessing the eye problems of the students? Do you have the criteria or evaluation tool to determine whether they pass that training that they should be done, that should be done this program?
We actually, in our city, we train teachers in this scenario. So we actually rechecked the visual acuity that the teachers also got. So we could actually see if it was reliable. So, and we, from there on, we implemented the extension inclusion criteria after we rechecked the visual acuity.
So you train for how many days?
We trained the teachers for about a week.
And then you have the evaluation after that, and then how many did you train?
Because the number that we were given was not followed because the other schools were not able to participate. So we got 6 schools, and from 6 schools, the advisory classes of the sections, the advisors were instructed to actually undergo the training so they could perform it during their home classes.
So how many teachers are there in the 6 schools? Or approximately average per school? I would like to establish the ratio of those who took the training and those who passed. If that particular school is capable of providing care to the students. Because in one school you might have trained let's say 6, and out of these 6 nobody passed. Okay, the evaluation criteria. That's why I would like to know how many were trained and how many passed the training.
We were not able to get it because we were in collaboration with organization. The data we got were only the examination procedures, and that was because we were most actively involved in that. In the training, we were assigned to different schools, and so in the undergraduate, we were all together. So the list they have was not also accurate because a lot of teachers did not attend. because it was on the weekend.
By the way, who did the assessment of the eyes? Are these the teachers who were trained or from the group?
Our refractive error from the group, CU interns, and we have optometrists as well, but ocular and care.
What data were gotten by the teachers?
They were the one who screened the students first to know if they were showing signs and symptoms for refractive error, and they performed the visual activity.
If I were included in the team of teachers who will help you in gathering data, what should be the things that I need to know for me to be qualified in the project?
We trained them to do the proper visual active technique and then a modified visual active.
Indicators now.
And then we instructed them on where and how the chart should be placed, the proper distance, and then we also asked them to know if they observe students who are actually going in front to actually at the board to note some observations they also see, and
They were also taught how to observe their students, if their students are squinting, if their students are their students have any external anomalies such as the dilated eye, which is observable by the teachers.
they were also taught a technique to visual activity word that students could not easily cheat, because some students tend to memorize the letters, so they were instructed to know how to classify if the student just memorize the letters. So they would perform it randomly instead of just making them in one straight line. So they would do it randomly.
What about the sampling technique? What did you use?
We use the purposive sampling technique.
Remember you have 6 schools. So how do you go about the sampling? How did you go about it?
We use
Sa amin school, paano ka naka-arrive sa total number of the 770?
yes, ma'am. We utilize purposive sampling technique because we have to acquire a certain criteria for the students, which is they should have refractive error and no ocular pathology. That's why after the examination, that's when we determine who are our subjects.
From what year? From grade schools. Okay, from what year? First year hanggang fourth year. First year hanggang fourth year. Kaya nga, the method may be something technique may be purposive sampling. However, when you have already this big number of respondents or subjects, so what method did you use in order to go about this refractive error examination? Lahat yun, yung 17 na nag-qualify, kinuhanan mo ng refractive
We checked.
error.
We performed it in a span of a couple of months, because we went to every school and then we checked all those. The teachers noted were students who had candidates for refractive error or visual problems, and then we checked them all of them with the help of a lot of CU interns, clinicians, and other licensed optometrists and doctors.
Regarding astigmatism, in which particular laboratory examination or test can you establish occurrence of astigmatism?
The type of
Saan
astigmatism.
doon?
You can see it at the refraction, because we base the type of astigmatism.
What errors may be seen? No? If a teacher, for instance, conduct, sabi mo kanina, tawag doon, visual activity, anong mga errors doon?
You can see the leak, actually, because astigmatism causes blurring of vision at both near and far. While in myopia, the blurring of vision is at far, so they have difficulty reading at far. While in hyperopia, when moderate amounts of hyperopia, they also tend to have blurred vision at far.
You know, the reason why I'm asking is because in your conclusion, you have a very important conclusion. You have already described describe the type of refractive errors there. So I'm thinking about na, how valid are the results, noting that the teachers were the ones getting the data and not the
No,
researchers.
ma'am. We were the ones who got the values, the refractive errors. The teachers do not refract. They are not allowed to refract because they are not.
Kaya nga, dun sa visual acuity, anong mga
Visual
error
acuity is
doon?
only a rough estimation of if they have refractive error present. So it's only for example, you say 20/20 vision as perfect vision for layman term. But for us, if we see it at 20/40, there is a problem. So there might be a refractive error, but we cannot determine the exact refractive error unless we do refraction in auto refraction.
In other words, the role of the teacher is just
Only
to
for
screen
screening.
who will qualify for the study. Ganun lang ang ginawa niya. Okay. Now, let's go to the next slide. First, this group is highly commendable in terms of the presentation. So they back up their results, they compare it with published studies, ang dami-dami nilang pinakita ng mga publications. That's very, very good. And also in the paper, you have good citations, correct citations. Isa lang ang comment mo, but in general, this is really scholarly done research. Nagawa ng isang undergrad, sobrang conclusion. Do not say in the conclusion there is no significant relationship between profile and refractive errors. That statement is a finding. That's not a conclusion. Never put statistical result in your conclusion. Okay? So, can you improve the paper? Kasi maganda masyado, baka kayo ang manalo. No. Meron pa, marami pa kasi doon. Dagdag na lang natin siguro yung first sentence mo, alisin natin. And then at the last part, pwede mo na lang isalagay doon, refractive errors do not vary across age and gender. Rather than saying there is no significant relationship, no? This is for all of you. Never put results of statistical treatment in the conclusion. That is for the findings. Okay? Congratulations, Gabriel. Thank you.